Hi, a very good evening to everyone. Thank you so much for spending your lovely evening with me as well as Dr. Chong. My name is Nana, and I'm your nutritionist for today as well as a. So for today, we actually have invited a really exclusive guest to actually share more with us on this session of prostate health. So let's get into this topic to find out how we can actually get stronger together. So this topic is specially exclusive for men only. All right, so I will share some statistics with you. So just want to share with you on the topic of benign prostatic hyperplasia. For men between the age of 51 and 60 years old, 5 people will actually have this BPH. And along with age, for men in between the old age of 80, 9 out of 10 people will actually be affected by benign prostatic hyperplasia. So we can actually see that along with age, the risk for BPH will in fact actually increase. So you might want to ask, actually, is there a cure for this? Is there anything we can actually do about this? So for this specific question, I will leave for our expert to answer later on. All right, so that's why we have invited a really special and exclusive guest together with us. Our guest speaker, Dr. Chong Kian Tai, who is a surgeon as well as a health tech innovator. So Dr. Chong himself is a urologist surgeon practicing mainly in Mount Elizabeth Novena Hospital and Farrer Park Hospital. So for him, he actually sees patients in both conditions as well as complex urologic cancers after completing full-time advanced clinical urologic oncology fellowship at the prestigious Memorial Sloan Kettering Cancer Center in New York, USA in the year of 2009. Dr. Chong himself is also an advocate for medical education, health tech innovation, and holistic urological cancer care. He is also the co-founder of Asia MD with its mission to overcome fake medical news and to help the public find the best medical care at this website of asiamd.com. So for me, myself, I've already visited this website a couple of times. So this website actually has published a lot of medical reports, a lot of medical articles that is being generated as well as being supported by a lot of medical doctors, as well as a lot of medical practitioners. So inside this website itself, you can also find a wide range of doctors, a list of doctors from different various fields, so that you don't have to waste time finding the doctors that you actually need. So if you really want to find out the latest information and also the latest medical news and of more reliable sources, this is actually a website that you can actually go to. All right, so you might actually feel that if Dr. Chong, you find him familiar, it's actually because Dr. Chong himself has actually been featured in various media before, including those that is featured in the media channel U, I think channel U, yeah, the Body SOS. So he has to share about prostate cancer. He's also being invited to this FM radio by this radio show as well. And also some of his medical advices, suggestions has also been published in this. All right, so enough of me saying, let's welcome Dr. Chong. Hi, Dr. Chong.
Hi, thank you, Nana. Thank you for inviting me. It's like going on your show.
Thank you so much for actually. Yeah, I'm really happy to you again. So I just want to know more about you, Dr. Chong, because I've been talking so much. I believe that our audience, they really want to hear more from you. So Dr. Chong, could you share more with us about your medical journey?
I've been a doctor for more than 20 years, and I'm a urologist now. So a lot of people ask, what does a urologist do? Is actually a surgeon who do two separate things. Number one, I tell people I'm an expensive water pipe cleaner, because anytime there's any problem with your urine system that joins the kidney to the bladder or letting the urine flow, I will make sure it's cleared properly. But the second thing I also do as a urologist is actually I'm a gynae for men. Then many people ask, how come I'm a gynae for men? Can you imagine if for men, usually if you have some problem with the private part, some questions, you can't go to a gynae, right? Because gynae is for ladies to go. So the gentleman also comes to urologists to find out about what they have, any problem with their testes, the penis, the prostate problem. they also come to a urologist. So that's what I do as well. So that's basically my day job. And of course, I love to do medical information. And thanks for sharing one of my startups that actually helps to make sure we don't have fake medical news. So thank you very much.
Yeah, I've visited the website and it's a very good website that to share with more people so that people can get access to the most reliable medical news as well. All right, so it seems like you are really the saver for a lot of men, which is the reason why I'm very happy that you are together with us again for this session. So while we're on this topic of BPH, like, is this has been like a myth that like, is it there's nothing that we can do just to
Yes, I used to
Dr.
hear.
Chong?
Yeah, I used to hear this as well. Say, oh, because 我老了, I'm old, so it's okay. This is what every man next to me, my neighbors, my friends all have. That is not correct, because you can actually relieve all these symptoms with different treatment. Sometimes it's very mild, and then you don't actually need to do anything. But sometimes when it's moderate or severe, we need to do something about it. And there are different things we can do. For example, there are medication that can try to relieve the blockage. So one of the medicine is actually called alpha blocker. There's a second kind of medication which actually let the prostate shrink to become smaller size. So there's not much blockage anymore. And that's called the F5 alpha reductase inhibitor. So these two different medicine works different way. The first one simply relaxes the muscle of the prostate, but the prostate is the same size. You just relax so that the urine can flow through well. A second one is the one that actually shrinks the prostate. But we always remember, no matter what medicine you take, there's always the good part and the side effects. So we always need to know what is the side effect of every drug you take so that you understand what are the things to look for.
I see. Okay. So because like there's a few treatment that you're going to share with us as well. So generally, like for the first is I remember just now when we do the IPS, the score, right? Like when the points is maybe like below 8. So you just need to do this monitoring by yourself.
That's right.
I see. So maybe when it gets more serious, then doctor will start to like advise you or which is the treatment that you should actually go for.
Correct.
All right.
Because
Understand.
IPSS is actually a very simple survey you can do. You can check on your handphone or anything. You can just do the score within the next 5-10 minutes. And if it's a moderate or severe, it's better to check with a doctor to see what needs to be done and whether medicine is needed.
Okay. And just now you talk quite a fair bit on the prescription of drugs and understand it's like potential side effects as well.
Oh, yes.
So in that case, like, you know, we have this myth that some medication can actually have some sexual side effects. Is this actually
right.
true?
So both the medicine actually for prostate unfortunately have different side effects. So for the first medicine that actually relax the prostate is called alpha blocker. So that medicine can sometimes cause giddiness or headache because it actually drops the blood pressure. A second side effect for this particular medicine is that the ejaculation volume will be less. So some men, when you have sex, the amount of ejaculate that comes out, the semen, is not a lot. Then you may not feel so high, and when you orgasm, the feeling is slightly different. So some men don't like it. How about the second medicine? There's a second medicine that I told you that can shrink the size of the prostate. It takes at least 3 to 6 months before it shrinks slowly. It's not like magic. You eat one pill and it shrinks immediately. No, it takes 3 to 6 months. However, there are also some side effects. Number one, you may not have erection as strong anymore. So you may have loss of your libido and erection may be worse. And then the sexual urge and then the performance may not be so good as well. So sometimes men, if you decide to take this medicine, have to know, do you want to pee or you want to have sex? You can't have both. So some of these issues need to be discussed with a professional so that you know what may happen. And unfortunately, when the prostate is big, you are on medicine you have to take for the rest of your life. So you have to decide which is better for you. Because enlarged prostate is just like when you have high blood pressure or when you have diabetes. Once it's there, it's there. So medication may need to be taken for the rest of your life.
Hey, but just curious, if let's say they really want to stop this medication, they have been like going on for maybe quite a while. then suddenly they want to like stop this medication. So is it going to, so all these sexual side effects, are they going to disappear in that case?
Sometimes it disappears, sometimes it doesn't, unfortunately. So that's why there are many different options. And actually some men actually decide not to do anything. So which is why we need to actually tell everyone there are other ways of treating other than medication.
Yeah. We see that there's actually quite a fair bit of different types of treatment when it comes to there's actually less invasive procedural as well as more invasive procedural. So what are actually all these different forms of treatment, and what are they suitable for, in fact, Dr. Chong? What's all this treatment?
Thank you for asking, because every man will get this, and then they will enlarge prostate. They need to find out what is good and what's bad of each treatment. So if the medication is not something they want, there is actually a less invasive procedure. Remember we said there's a medicine that actually relax the prostate to relax the urine tract. So there's exactly a way that we can do this called Urolift. On the picture on the left-hand side, number 3, you can actually see some rubber band kind of thing that open up the prostate. So it's like at home, if you have a curtain at your window, all we need to do is open up the curtain on both sides. Then you can see the scenery outside your window. We do this exactly the same way. And the implants are permanent inside the prostate. And it is safe because it's similar to implants we use for many other parts of the body. And the string that is used is actually a suture that we use for operation stitches. So it's exactly the same. So it's safe to be inside. And even if you go airport, you wouldn't sound the alarm. So this is called Urolift. There are also other treatment like Resume, which is actually using a water vapor to cook the prostate. We actually use steam to cook it. And the third one is microwave therapy, which we actually also cook the prostate in a way. The aim of cooking in a way is so that the prostate cells will actually die off, and eventually the prostate size will shrink a bit. So the last way is not very popular, which is catheterization, which means to put a urine bag into you and you carry around for the rest of your life. And most men don't want it. So these are the less invasive way. And Urolift and Resume and all this, all can be done within usually about 30 minutes, and you go home on the same day. Among all these procedure, if you are concerned about sexual function, Urolift is the one with the best result, because it does not cause erection problem, Urolift does not cause ejaculation problem, and Urolift does not affect the sexual performance. So there are different good and bad point of each. So check with your specialist on which is more suitable for you. However, if the prostate is so big that all these less invasive procedure can't be done, we have to do something more invasive. The goal of more invasive surgery is to resect, that means remove the blockage of the prostate path. So imagine just now I talked about if you have a traffic jam from Woodland to Orchard Road, right? The car is stuck at Toa Payoh. You have to actually go in and pull the car away so that the traffic can continue flowing. So that's what we do for prostate resection or vaporize, or different ways of relieving the blockage, is to make sure the path of blockage is removed. That is a slightly more invasive surgery, usually takes about 1 hour, and most of my patients go home the next morning after breakfast.
I see. So am I correct to say that, like, for people who don't want to take the drug treatment, they can actually choose this less invasive procedure, which is lighter and more mild?
Yes, they can choose, but every procedure has a good and bad thing. For example, Urolift, the procedure, you have an implant inside. Some patients do not like the idea of having implant. But if you imagine some people who have heart attack also put heart implant, right? Like a cardiac stent, right? So similarly, this is something that's permanent. And different treatment like Resume with water vapor, when you go home after treatment, usually you need to carry a urine back home for sometimes a few days or weeks. So some patients may not like it, then they don't choose this. So please ask the doctor what is good and bad of each treatment before you decide which one is best for you.
Thank you so much for coming for this session, and really hope that next time we'll be able to invite you again and come for the next session also. Okay, hope to see you next time.
Thank you very much for inviting me. It's a very fun session. Thanks a lot.